In the last episode, we talked about circumcision that perhaps may or may not help with penile enlargement. On that basis, when we move to the month of April, we're going to talk about circumcisions. This week, I received an email from an adolescent who has been persuaded by his father in order to go for circumcisions at the age of 15. So his argument is that what are the ways to put forward in order to ask his father perhaps to reconsider of this family ritual. Yes, there are scientific evidence that circumcision will help you to keep yourself clean and hygienic. And in fact, the most impressive recent year circumcisions data comes from Sub-Sahara Africa, when circumcised men are proven to have less chance of contracting HIV. For example, a man who is HIV negative and has a 50 to 60% less risk of contracting HIV from a HIV positive women. And that usually will just be quoted as a heterosexual man has about 50% chance less of getting HIV. The mechanism of this is unknown. A lot of people attribute towards when the circumcision is done, the glands of the penis has keratinized skin and less moist and less of an area for the glands to contract frictional injury and contract HIV infection. But we have to consider, obviously, there are complications associated to circumcision as well. The actual situation is that we would consider circumcision is only ideal for someone who needs it clinically. For example, it is true that young boys may have problems of urinary tract infection if they actually have foreskin. But girls have urinary tract infection as well. We don't do anything surgically to the girls. So if you have an infected arm, you're not going to chop it off. What you need to do is clean it on a regular basis. So hygiene and hydration is a key issue here. And of course, we have data to suggest that men who are circumcised compared to men who are not circumcised, the actual issues about libido, erection, and also ejaculation timing is not affected. But increasingly, there are data to suggest that when you remove the skin, you remove many fine nerves that actually perhaps may be useful for sexual pleasure. But if you can get away without losing them, why don't you protect them? So for this young teenager who's trying to put forward this argument, what Dr. G say is that in life, everything cuts both ways. If you weigh out the pros and cons, perhaps if you keep your foreskin clean and regularly make sure that you are well hydrated and don't get urinary tract infection and protect yourself with condoms, then that can be a good point of argument to tell your dad that you can keep the skin and don't cut to the chase. In continuation with our April series focusing on circumcision, I'm going to talk about things that can go wrong with circumcisions. Yes, a simple operation like that can end up with a botched job. If you're keen in order to put your kids forward for circumcision and want to make sure things like this don't happen, or if you're a sufferer of a botched job, then you need to stay tuned and stay focused when you are putting Dr. G on the spot next week.